Reluctance to early cancer screening has been termed as one of the leading causes of late detection and increased mortality among Kenyans. Consequently, health experts called upon Kenyans to embrace frequent testing to avert deaths attributed to cancer. Data from the National Institute of Cancer in Kenya indicates that 70% of cancer patients succumb to the illness, with only 30% surviving, a situation health experts say can be reversed.
In the country's capital, Kenyans in their number turned up to mark the World Cancer Day. Here, health experts debunking the myths about human papilloma virus as well as its vaccine.
One of the main challenges facing us in this fight against cancer is the low uptake of screening and early detection services for the most of cancers. Less than 15% of the women in the reproductive age group have ever gone for cervical cancer screening, while only 10% of our women have ever gone through clinical breast examination from a healthcare provider. We must put greater effort towards screening and early detection to reverse this unfortunate situation.
Barriers and inequalities that exist include misinformation, stigma, inadequate infrastructure, untrained personnel, and lack of equipment. These have led to unfortunate situation we find ourselves in, whereby most cancer patients, even where they are within the healthcare system, are diagnosed at late stages, resulting in poor treatment outcomes and lower survival rates.
The same clarion call was echoed in Meru County, with women between the age of 25 and 65 advised to embrace cervical cancer openly.
Wote wajitokeze hii wiki yote kuanzia hata leo ama hata kesho. Hii mwezi yote watu wajitokeze waende wapimwe. Na ile kitu tunajua kama watu wenye wataalamu ugonjwa wa kansa katika Meru Hospice, na ile masomo tumepitia, kansa ikijulikana mapema huwa inapona.
After hearing from the nurses, our journey leads us to Gladys Kairigo's home. Gladys suffers from cervical cancer and has been receiving palliative care from Meru Hospice. The burden of treating cancer skyrocketing with each passing day. Gladys wants the government to help eradicate the menace. According to the records at Kenyatta Hospital, 15% of cancer patients come from Meru County, a figure which is causing an alarm. Amid concerns of making cancer treatment affordable, Mary Wathanu, a blood cancer survivor, says cancer is not a curse.
Matibabu si eti ni rahisi, ni expensive, na ningetaka encourage familia ambao wameambiwa mgonjwa wao kuna saratani anaweza tibiwa na wanaweza tembea safari salama, kwa sababu wakati mgonjwa ameambiwa kuna kansa haijalishi ako which stage, kwa sababu hata kwa stage 1 ama stage 4 lazima huyu patient atataka kushughulikiwa vizuri.
Kama uko hapa na unaogopa kupimwa ati ukipata kansa utakufa, sisi tumeishi na unaweza ukaishi pia wewe. Mimi kansa nilipimwa mara ya kwanza 2007 na niko hai hadi leo. Kwa hivyo matibabu inafanya na tunaweza tukapona. Mimi sijaenda India, sijaenda South Africa, nimetibiwa hapa Kenya.
It's good to understand that all of us at some point we are candidates of cancer. And when one of your members is affected, please come close to them, talk to them, be there for them, because you never know about tomorrow.
Health Cabinet Secretary Susan Akumincha, while opening the Regional Cancer Treatment Center at Garissa Referral Hospital, said the region's prevalence with cancers of the head and the neck and urged Kenyans to go for early screening.
Here in Garissa, we mostly see cancers of the head and neck, and I am concerned that they presenting very late to our facilities. I know that we can change this experience.
Lifestyle being a contributor to the rising cases of cancer, Kenyans have been urged to avoid multiple sex partners to lower the risk of transmitting HPV virus, as well as observe a balanced diet and embrace indigenous foods like yam, cassava and arrowroot, which are rich in nutrients.
The rise in the number of cases of cancer is due to aging populations arising from improved life expectancy and the increasing adoption of risky behavior, such as consumption of unhealthy diets, lack of physical exercise, harmful use of alcohol and tobacco use. It is noteworthy that the health system capacity to detect and to diagnose cancer cases has been progressively growing, leading to higher proportions of the population being able to access cancer diagnostic services.
Kwa sasa tunaendelea tu bado na ratiba yetu.
For Legends Edition, I'm Gladys Mungai.